I'm Jordan, a nursing student. Can I get your SBAR report for your patient?
Sure. Hi, Jordan. We have Marta Yarn today. She's an 80-year-old female with no known allergies. She is a full code, a patient of Dr. Jolly's. She is widowed and living alone. She does have 2 living children, but they are out of state. She comes in with a non-healing sacral ulcer, stage 3. She has had it for 3 months and treated as an outpatient with no success. She has had multiple admissions for dehydration and pneumonia, last being 6 months ago. Patient does not smoke, does not have a history of heart disease or other chronic illnesses. She has not needed long-term O2 therapy. She's alert and oriented, ×3 cooperative. She is slightly hard of hearing and does have 20/40 vision. She's up with walker and standby assist. Her chest expansion is symmetric, clear in all fields, diminished anteriorly and posteriorly. She denies any chest pain, palpitations, shortness of breath, syncope. She's sinus rhythm with occasional premature beats. Her abdomen is soft, non-distended, slightly obese. She has bowel sounds ×4, stool is brown, verbalizes decreased appetite, no complaints of nausea, vomiting, or changing stool pattern, consistency, or color. She's on a regular diet and she will be NPO after midnight. She does complain of occasional stress incontinence with nocturia. She denies pyuria, hematuria, and vaginal bleeding. Her skin, she is frail. It is frail, thinning skin except for the sacral wound, which is 4 by 4 centimeters by 1 centimeter. Surrounding tissue is kidney shaped. She does have serous exudate drainage without unusual odor. There is no tunneling, bruising, or undermining. Her last set of vital signs, her respirations were 24, heart rate 88, 92 on O2, and her blood pressure was 144/90. Her albumin is decreased at 3.2, potassium increased at 3.6. Her white blood cell count is up. Hemoglobin's down at 12.1, hematocrit down at 37. She did have a blood culture done and that showed positive for E. coli. We will be giving her antibiotic today, gentamicin, and that's going to be running along with normal saline and 20 milliequivalents of potassium chloride. Her plan while here, she'll be following up with nutritionist and wound care after her procedure. We will be increasing her protein intake. And for now, for her wound, we're just going to clean with saline and cover with hydrocolloid dressings. And her plan will be wound debridement tomorrow. Do you have any questions?
Yep.
Okay.
Why specifically is this client receiving this medication, and what action does the medication have on the body?
Okay. Gentamicin is an antibiotic to treat bacterial infections such as the E. coli, and it inhibits bacterial protein synthesis through irreversible binding to the 30S ribosomal subunit of susceptible bacteria.
When should you question administering this medication? Does the medication have therapeutic serum level? Which vital signs must be monitored, and which physiological parameters should be monitored when the medication is being administered?
Okay. You should question if they have a hypersensitivity to aminoglycosides or intolerance to bisulfites. Renal impairment can cause nephrotoxicity. It can also cause ototoxicity, vertigo, ataxia, and muscle paralysis. Therapeutic levels would be 0.5 to 2. All vital signs need to be monitored. We'll check I's and O's with fluids running to assess hydration and renal function. We'll also continue to assess for infection throughout therapy by looking at her white blood cells, wound appearance, and temperature. We'll continue to monitor vestibular dysfunction such as vertigo, ataxia, nausea, and vomiting.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting and at home?
We will instruct the patient to report any signs of hypersensitivity, tinnitus, vertigo, hearing loss, dizziness, or difficulty urinating. and we will advise the importance of drinking plenty of fluids.
What are the side effects and potential adverse reactions?
Ataxia, vertigo, ototoxicity, nephrotoxicity, muscle paralysis, and of course hypersensitivity.
How will you know the medication is effective?
Through her being clear of signs of infection, through obtaining new cultures, and white blood cells being in the normal range.
Okay, that's it.
So, okay, so I'm going to pull up in the MAR that we're giving gentamicin. Let's see here, running at 80 milligrams over 1 hour, and the sodium chloride with potassium, 20 milliequivalents. Check the allergies. There are none. Check the time to make sure that it's due. We'll also check to see if the patient's having any pain. Morphine is due if they are. And I have my bags back here, so I'm just going to check to make sure sodium chloride and the gentamicin, and we'll go in. Okay. Hi.
Hi. How are you?
Good. How are you?
Good.
I'm Andrew. I'm going to be your nurse today. What's your first and last name and date of birth?
My name is Marty Yarn. Yarn. I'm 8 years old.
And do you have any allergies?
No, I do not.
Wonderful. Are you having any pain today?
No,
Good.
not currently.
Okay. So I'm here to hook up your antibiotics. Do you know why you're receiving antibiotics today?
I have an infection.
So you were positive for E. coli. Do you know of any signs or symptoms that you should be looking out for when receiving your antibiotic?
Shortness of breath. Hives.
Dizziness, hearing loss.
Oh, okay.
If any of those happen, turn on your call light.
Gotcha.
So again, I'm looking in the MAR, confirming no allergies, confirming the drugs, the gentamicin, the sodium chloride with potassium. Okay. Checking the right patient, which is Marta Yarn. Right time. Gonna scan your armband here. We get the sodium chloride. in the tubing. It's open.
Can I see what you're doing?
Sure. Okay, there we go.
Oh, then I didn't know how to do that. Thanks for showing me.
Sure. Alright, so hang that up there. Need to make sure that the IV site is patent. Cleaning. Do you feel any burning?
No.
Good. IV site looks good.
Everything's good to go.
Oh, maybe I should put the thing in here.
Not that one. Is it that one? No, no, no. Other.
Hmm?
Other right one.
No, she's taken off. We're gonna, no, that's fine.
Is it?
Yes. That's the very nice. Alright. Alright, 1, 2, 3.
Hi, how are you? My name is Veronica.
Hi, how are you? My name is Veronica.
Okay, so selecting channel A, guardrails IV fluids. We are running the sodium chloride with the 20 kcal.
She was admitted today with non-healing cerebral ulcer or
The rate is at
stage 3 ulcer, 4 times
125, double checking
involvement of surrounding tissues, kidney shape,
the molar.
no unusual odors, serious X-ray, no underlying tunneling or bruising. She was treated as an outpatient without success. And she's planning for sacral wound debridement tomorrow. She's in poor functional status, but she's able to take care of herself.
And we'll set out the IV piggyback with gentamicin.
Her skin is very thin and she has a poor skin and turgor. Otherwise, she's alert and oriented and
Just like
cooperative.
the bag.
Premolar, stool, soft in
set up our secondary here.
Law is 3.2, white blood cells are high, and palpitation is over contaminated. Recommendation, white blood cells should be monitored and temperature too, respiration rate, hepatic and renal function, also potassium because she receives normal saline with potassium inside. And nothing needs to be
Maybe I should scan the medications.
one needs to be cleaned with saline and covered with 500 or
Alrighty.
that's all.
Alright, I had some questions for you here. So why specifically is client receiving this medication?
It's to treat her wound. She has a wound or a critical wound that has E. coli in it right now, and gentamicin is being prescribed for serious infections.
Okay, and what kind of action does the medication have on the body?
This medication is bactericidal. It means it kills all the bacteria.
And when you should question administering this medication?
She has a hypersensitivity against any glyphosate.
You scan your arm band again.
Her renal function or something that can cause hepatotoxicity.
And does the medication have a therapeutic serum level?
Yes, it's between 5 and 8 micrograms per milliliter.
And which vital signs are being monitored?
It's an infection, so you will monitor the temperature, definitely respiration. They're high now, but they can go low because she has morphine.
Okay. Is there anything else I can do for you?
Oh, I'm okay. Got my call button here.
And which physiological parameters should be monitored when it comes to medication as well?
That's why it needs to be monitored with the medication. The potassium definitely because she's getting potassium.
I have a few questions to ask you.
Okay.
Were there any pertinent pieces of information you reviewed before administering a client the medication?
Yes, I reviewed the 5 rights, the dose, the route, the patient, the drug time, and double-checked all patient identifiers. Also, that the gentamicin was compatible with the normal saline and potassium.
Did this information affect your decision to administer the medication?
Yes. Without everything checking out, we wouldn't have given the medication.
Did this information affect how you administered the medication?
Sure. If the order wasn't compatible, then we would have had to administer the gentamicin differently.
Okay.